let's talk about surgery options for heavy periods. There are several surgery options that can help either decrease the amount of bleeding you have or stop your bleeding completely. The first one we'll talk about today is called endometrial ablation. This is a procedure where we use first a camera to look inside your uterus called hysteroscopy, and then we use a device to burn the inside of the uterus, the lining inside the uterus, all the way down to the stem cells that regenerate that lining each month and then cause your period. By burning all the way down to those stem cells, it helps your uterus to not grow a very thick lining each cycle, and then helps you to have a much lighter period. The goal of an endometrial ablation is to make your periods more normal, more tolerable, and much less heavy. Some women do stop having periods after an endometrial ablation, but not everybody. So again, the goal of that particular surgery, the endometrial ablation, is to make your periods be more normal and more tolerable. The endometrial ablation surgery is a surgery we do as an outpatient. That means that you come to the surgery center, you have your surgery, and you go home on the same day. The downtime for that surgery is very short. The recovery is very quick, and you can be back to your normal activities in just a day or two. That's why many women do like that surgery, because it helps control those heavy periods, but it's not the risk of a big surgery like hysterectomy. So again, you come in, you have your surgery, and you go home the same day, and you're back to most of your normal activities in just a couple of days. So most women are candidates to have an endometrial ablation. However, sometimes that's not the right surgery for you. A couple of examples might be if you are known to have abnormal cells inside your uterus, called endometrial hyperplasia, or if you have risk for developing uterine cancer in your lifetime, or sometimes if you're very young and a long duration of time away from menopause, that can increase your risk that that surgery will fail. And so there are times when an ablation might not be the right surgery for you. If you're interested in an endometrial ablation surgery to help with your heavy periods, I again invite you to come back and talk to myself or Dr. Hobson about that surgery, because we can determine if that's the right surgery for you, and if not, then we can talk about other options that would work best for you.